Some of you may hear this question from patients a lot. We hear it a lot. We have a lot of people who come in with different problems, from thyroid issues to cardiovascular disease to hormone problems to just all kinds of overall health complications, immune issues that are obviously outside of the scope of dentistry. So we absolutely understand the connection that dentistry has to helping them with those problems. But then there is a level that, hey, we need someone else on board that specializes in addressing those kind of issues. I hear at least, I know all of us do in this practice, at least 2 to 3 times a week, who do you know that would be good for that? And I got tired of not knowing how to answer that question. And I just felt like to have a really good resource for our patients to direct them to people that are doing these things that can help them with these other issues. I mean, what a great group if we could develop that. So that's how this developed. So today what we want to do, I'm going to just show a little bit of, Jennette actually sent this trailer to me of this movie, which I'm in the middle of watching. I don't know if any of you have watched it. It's a very good movie called Escape Fire. Has anyone seen it? When I went back to, Jennette pointed it out to me, when I went back to Liquid, it came out in 2012. How did I miss this movie? But so let's start with that because it does help sort of set the tone of why we're here.
The American healthcare system is badly broken.
The present system doesn't work, and it's going to take us down. We need a whole new kind of medicine.
We're in the grip of a very big industry, and it doesn't want to stop making money.
If I spent 5 minutes with you and then put in one of these stents, probably get paid $1,500. For me to spend 45 minutes with the patient to try to figure out what their true problem is, probably get paid $15. It's a completely irrational system.
We don't have a healthcare system in this country. We have a disease management system.
We're spending almost twice as much in America as any other country on earth, but our lifespan isn't even in the top 20.
30,000 Medicare recipients die each year from care they didn't need. That's the equivalent of a jumbo jet crashing every single week. The aviation industry killed as many people, we'd be up in arms.
The administration pays you based on how many patients you see. All right, who's next? If you try and buck the system, someone says, what can we do to get your productivity up? I'm not interested in getting my productivity up. I'm interested in helping patients.
We're seeing the military just being a microcosm of the problems society's having.
Soldiers' use of prescription drugs has tripled in the past 5 years.
This medications I was on.
Only by accepting that the American healthcare system is badly broken will we be able to seek out the escape fires, the potential solutions. There are answers.
One company has figured out how to lower healthcare costs by more than 40%.
We provide incentives for people to engage in healthier behaviors.
The Army Surgeon General directed that we establish the Pain Management Task Force to take a look at alternatives to narcotics.
I was skeptical. So skeptical.
I've gotten a lot of inspiration, a different perspective. There's a different way of doing things that is possible.
If I think about what healthcare could be like, it would have a lot more care in it.
The healthcare system is unsustainable. We're really mortgaging the future. Not just the health of healthcare, but the health of the nation.
So thank you, Jennette, for sending that, because that really kind of nails down the message of, I think, why we all practice the way we practice. And our patients, I know I see it, patients are desperately seeking that kind of care. And they're challenged in trying to find it. So that's why we wanted to have this group developed to make it easier resources for patients. So what I wanted this evening to look like, Jennette and Dr. Asher have graciously offered to begin the process of introducing themselves and their practices and what they do, why they do it. I think our why is very important to our passion. Our why is our passion, actually. So I want to get to know all of you better. And so I think that's the best way to get that started. So they're going to start that process, and then I do want to hear from everybody so we can start to realize, so what kind of group do we have here, what kind of resources do we have to recommend to patients, and then maybe your notepads on the table towards the end of the meeting. thinking about maybe 3 top subjects that you feel like that you really hear a lot and you work a lot with on patients. Because one of the things that I envision is us having meetings with patients present where we can invite patients to come for an informational time. They are hungrily seeking truth in their healthcare, and the internet's not the most reliable place to find that. Even though we all have really great websites, I'm sure, it gets very cloudy and they get very confused when they start searching. So if we could establish a couple of times a year where we invite patients to come in and we divide that up on who is the best to talk about some of these subjects to help give them guidance in their care, I think that would be just an awesome, wonderful resource for people. I would love to be part of that. I think that would be exciting. So, Jennette, what's you?
And before you start, I'm going to be the bad guy, and I've got to keep us on a schedule, so if you're long-winded, I'll probably cut you off. I'll give you this. I'll give you the finger. Not that finger. I'll give you this finger. I'll give you this finger. And that means you're almost done.
Thank you, Jennette.
No problem. So my name is Jennette Berry. I actually found Shannon kind of the same way. She was looking for people. I had patients in my practice almost weekly where we would be taking them through education, oftentimes for the example on detoxification, and I would know that they had mercury fillings and I needed someone that could safely address that, or I would have a family with overactive immune system and I wanted someone who wasn't going to stimulate that and go down the wrong pathway. And then I kind of went through some of my own. I'm going to touch on a little bit more about my why, but my own personal journey. But my 13-year-old was at the point she needed braces, and we started that process. And we have a big family history of autoimmune on both sides. That's why I'm so passionate about what I do. And we went in, had a consult, 6 months, 8 months into it, and they recommended pulling some teeth and permanent and to create room. And I was like, I don't know about that with immune system and already some overactive immune system stuff. And I literally had a client in that week whose kiddo had pandas, and we had that conversation, and she was like, I've heard that there's this dentist in Tulsa. And I'm like, well, I've been looking for someone for me, and I need someone for our clients. So I appeared in her office, and she so kindly said, no, you're probably thinking correctly. You aren't crazy. And so we started forming a personal relationship. But I think probably collectively we can all agree we're in a pretty big healthcare crisis right now. There's not enough of us to go around, especially in Oklahoma. Disease rates have skyrocketed over the last 20, 30 years. But 26 almost years ago, I started down the path of what I thought was to go to medical school. I had an undergrad degree in nutrition and biomedical sciences. Was accepted to do some graduate work in nutrition, and I got really sick. And I went to a doctor, went to another doctor, went to another doctor. 7 doctors later, and I was about 22 years old at the time. 3 of those doctors whipped their pads out and wrote me anxiety meds because it was all in my head. And I mean, it just, trajectory completely changed. I was like, I don't know if this is what I want to do. Well, I'll go and keep pursuing nutrition. So I started my graduate work and was in Boston and was introduced to the concept of integrative medicine, at the time called alternative medicine even, right? And I thought, okay, this makes so much sense to me that the body inherently wants to heal itself, that we're interconnected, especially with some of the things I was going on with. So I continued to do my training in that, and I'm classically trained as a dietitian. So I kind of dip my toe out there with that because unfortunately, we haven't done a real great job in our profession. And I cringe a lot of times with a lot of the things that I hear that we do. And I moved back to the Midwest, and no one thought like I thought. I mean, they just didn't. It was very far and few between. And I started doing all of my training in functional medicine through IFM. I'm probably a little partial to them as far as gold standard, but I have had some phenomenal experiences and colleagues through the years in their practitioner program. And then 7 years ago, I decided I wanted to open up my own practice. My husband and I went through our lost our son at birth, big stress. And my husband was the perfect picture of health in October. We got pregnant with him early that year. We lost him that summer, and by August he had autoimmune disease. And I thought, okay, and, we've got to practice what I preach, but I dove into his own health. At the time here, 7 years ago, I wasn't even really finding anyone that could help me with that. And I'd always wanted to open my own practice. He's kind of like a Joey. He's the jack of all trades in my practice. He, unfortunately, is very entrepreneurial mindset and helped me set it up correctly. I very naively early on thought I could do it under insurance, and we got our teeth kicked in because insurance doesn't want to fix people. I mean, that's just bottom line. They want to prescribe meds and do surgeries, and that's the extent of what they want to do. And at that same time too, so talk about the role of stress, my mom had autoimmune disease, and we talk about chemical stress in our practice and educate on that. And she was teaching across the street from an oil refinery, and then they built, which is crazy, they have a school across from an oil refinery. And then they built the new school across from an old Sherwin-Williams paint plant, so that was a smart idea, right? And she had heavy metal toxicity and developed a very, very rare aggressive blood cancer. And I tell this story all the time to my patients when I speak, that I've had two mentors in my life. First one was a swim coach who introduced me to the concept that nutrition made a difference in my performance. Second one was my mom. And generally I don't even tell them who I'm talking about. I just tell her story, and she was an educator. I saw the power of one, educating, but ultimately two, what mentoring could do. And she was that teacher who drug a washing machine up to the school to wash her kids' clothes because they came to school with cat food on their clothes. She taught our town, 90% of the town was impoverished. She brought kids home, all the time for dinner. I saw, when we had her, ultimately she passed away when we had her funeral, and 500-600 people were there. Most of them former students who told stories about her, filling out scholarship applications for them to go to college because she was determined they needed a college education. It just really, I think, impacted me about the power of mentorship, and we wanted to have that in our practice. So when we work with someone as a practice, I'm very passionate about education. I tell our patients all the time, I want to empower them with their health. I don't want them to be dependent on seeing me. I don't want them to see me in 2 or 3 years. I want whatever period of time it takes to get them on the path to healing, that they go, okay, Jennette, I've got this, peace out, see you later. I know exactly what I need to do to take care of me and my health. So ultimately, what we do as a practice is dependent on our ability to give a really great education. When we work with someone, yes, I address nutrition because food as medicine is powerful. It's the core of who I am in my training. But also, I also know that you can have the healthiest diet in the world, but if you've got crummy gut health and you aren't detoxifying, it's not going to get you very far. Or if stress is really high and your hormones are imbalanced and your neurotransmitters are out of balance from that. So we take an educational process and address all of those areas with our patients when we work with them. We've been fortunate. I'm always looking for other practitioners too. We work with a lot of great docs in this area, a lot of great doctors still in our conventional system, and they're looking for people. I tell this story often. I got a call about 6 months ago from a doc at UPC, and she's like, Jennette, I've watched from afar. We've had some of your patients in our practice, and we've seen the transformations they've made, and I can't do that. And I don't know what to do with these people. She goes, I got women that come in and see me every month, and they're like, my hair's falling out, I'm tired, I feel 15 years older than what I am, I've got digestive issues, but I don't know what to do with them. If they need an antibiotic for cold, great, or if they have a broken arm, great, but she's like, I can't help them with all the other stuff, not in 5 to 7 minutes. And their hands are just tied. I'm always emphasizing, I think we all collectively went into healthcare because we want to help people, and even in the conventional system. I think collectively physicians, practitioners want to help people. They're just in a really crummy system right now. And so we work with a lot of docs in our area, but I'm always looking for, acupuncturists. I've got someone here tonight I need to meet. I know that we share a patient because she was looking for someone. Chiropractors, I'm always looking for someone. There's areas sometimes that I maybe want to pull in that I'm not as well trained in, or that outside of my scope of practice I'm not comfortable with addressing. So I think this is awesome. We've done this. Thank you. We need that. We need this. We need more healers in our area. In a nutshell, that's who we are. My main office is in Owasso. We have a satellite office in Tulsa. I do a dip your toe in approach. We just kind of started that last fall. We had a lot of practitioners reach out to us and say, hey, I believe in functional medicine. What you do is really great, but like I have no idea how to explain that to my patients. Can you come explain it to him? And my husband had the bright idea versus me going around to offices. He's like, why don't you do something? And so I've gotten outside of my comfort zone and the four walls of my practice because I'm passionate about what I do. And I've started, we do some periodically, at least a couple times a month, we do very laid back and formal dinner seminars. We have dinner, we keep it casual. I figure what a better way to meet someone other than break bread together. They can meet our practitioners. I have 2 other lead practitioners in our office. We all have different areas of specialty, but they can meet us, understand what functional medicine is, what's a functional approach, what do you work with, because we don't do everything well. I don't want to do everything well. I want to have our area that we do really good. We do a lot of hormones, not bioidentical, but balancing them naturally, a lot of autoimmune, a lot of gut, food sensitivities. We do a lot of weight. A lot of people, I say they don't even know what they have. They just know their hair's falling out, they feel 15 years older, and they get a phone call that their labs are normal. That's what we see a lot of. So in a nutshell, that's who we are as a practice. See, a lot of anxiety, depression, mood, that's another biggie. The last year or 2, I've started noticing seeking out alternative options because that need's just not being met in healthcare. So I look forward to meeting all of you
What's the name of
developing relationships.
What's the name of your practice?
Functional Nutrition Resources.
Okay.
So is the name of our practice. We're right off 169 in Owasso is our main office, and then we have a satellite office right at 32nd and Harvard.
Did you bring any cards?
I did, and I will put those out.
I would love to grab them. We're giving out bags for everyone to take home with everybody's cards that are brought. So
Sure.
if you need any cards, I would love to gather.
Yes.
Thank
Yes.
you.
Thank you.
Thank you.
Thank you. I am also happy to be here tonight. This is a delightful gathering, and I certainly appreciate the concept. What is being created here? You are on the ground floor of something that is going to change healthcare practices in this part of the state and beyond. So I'm excited to be here. So thank you, Joey, and thank you all for coming. So my name is Dave Asher. I'm an osteopathic physician. I have been in practice in Tulsa since 1983. I did my training at the osteopathic school here in Tulsa. I graduated in 1980. So I have some years, and I did family practice, just what you might call traditional general practice doctor for 12 years, and discovered that really that's not the kind of practice that I wanted to maintain because it was too busy doing too many things, and I didn't feel like I was able to do all things well. So I did limit my practice to musculoskeletal pain management and began to call myself osteopathic pain management in the 90s. So I have been in Tulsa since '83 and practicing more recently just down the street on 21st Street, and my practice is focused on chronic musculoskeletal pain. My intention is to identify and treat chronic myofascial ligamentous articular strain. I do cranial manipulation, which I find very useful at bringing the body into balance. So my practice is largely people who have been to 10 doctors and 7 doctors, and they are still looking. So sometimes it is physical therapist, sometimes they have been to chiropractors, sometimes they have been to a trainer, sometimes they've been to other osteopaths. So there's always something missing, and I look for that. And I feel blessed to be able to find things, help people get back to establish normal function. And then if they have tissue damage that would be related to ligamentous sprain, or what I call medical gumbyism, also known as ligament laxity and joint hypermobility. If they have an issue with that, then I do prolotherapy, which is ligament proliferative injection treatment. I've been asked by a chiropractor in Muskogee to train in stem cell therapy, so I'm going to be doing that this spring, and we'll probably have, maybe we'll offer that in the future. So I'm kind of excited about being able to offer a more well-rounded practice as it relates to musculoskeletal health. So when I did family practice, it was more a traditional model with hospital practice and see as many as you can in the office in a day, and then, and you know that because we've all been pushed, and we're frustrated, and so I was able to stop being an insurance doctor and a Medicare provider in 2007, and I have since then been a cash practice, and that scares a lot of people off because I do take 2 hours with my first patient and an hour or more with subsequent visits. So people, cash practice is a little difficult to embrace for a lot of people, and that's fine because people who need help will find a way. So when they're sick and tired of being sick and tired, you're going to do something different. So I want to be that person. So I want to be just like you in the sense that you offer a service that nobody else will offer. It's not that they can't, it's just that they won't. And they've been postured, and they've been shaped and molded by the system to the point that they are less what they could be and more what other people want them to be. So we share that. We share that sense of community. We share that sense of need to do something more. And I want to be that person for you. So if you're a chiropractor and you've got patients that you just don't want to see again, I want to see them. Okay?
How about dental patients?
If it's a TMJ, head, neck, and facial pain, yeah, bring them on. I love them. Yeah, I love them. I also use some nutrition. I'm very passionate about a hemp product that I've been using for years. So if you're interested in hemp and a very broad, full spectrum hemp plant product, I do believe that I represent the very gold standard of all hemp products. And we can talk about that. I don't want to wear you out because I know other people will use hemp products, but I really do believe that Zelise Ultracell, which is now the nation's #1 selling hemp-derived CBD product and garners 15% of the total CBD market in the country, is the best product. And I can tell you in 4 minutes why it is. So talk to me about that. I also use a nutritional support product called Protandem, and perhaps you've heard of Protandem. It upregulates antioxidant production. It's not an antioxidant, it's actually a pro-oxidant, but it stimulates your body to make its own antioxidants. And it also upregulates about 500 survival genes so that people just increase their measure of health. So if you have an issue with inflammation, obviously you want to reduce inflammation. But why can't you also upregulate your body's ability to make its own antioxidants, NRF2 activation? It's an excellent product. So I do feel like we've got some options in health. You want to eat right, you want to sleep enough, you want to exercise appropriately, but what else can you do to upregulate your body's health? There's some other things that can be done. So I want to be a part of that with you. I want to support what you're doing, and I want to know more what you do so that we can collaborate in this effort.
Thank you. Can we just go around the tables now? So which table wants to go next?
It doesn't have to be as well thought out. It could just be.
No, we just want to hear.
Bullet.
Can I sit?
You can do whatever makes you comfortable.
Do you want me to sit or stand? My name's Holly Thompson. I'm a physical therapist. I work at, it's called Life Motion Balance Center. We specialize in balance rehab, specifically for the geriatric population. We also specialize in vestibular disorders, so any kind of dizziness, BPPV, vestibular neuritis, labyrinthitis, vestibular migraines, motion sensitivity issues, and then going into that, which can be wrapped into that, is concussion care. So with our concussion management program, we see patients that, we see a lot of different athletes. Usually the kids from TU, if they're not recovering along the lines that the trainers see, they'll send those kids to us for rehab. We have connections with some different club sports in town that we baseline test kids' balance and reaction time, so we have nice data on that. And so if those kids get a concussion in their sport, we can rehab them back to and help them return to play. We see a lot of people post car accident, and then also the elderly population with falls. So those are our three main areas that we focus. I know Megan will speak in a minute, but Megan and I have gone on a journey for a long time together in the nutrition and wellness world, where we really like to think outside of the box. Even that we both worked at St. John, we've both been in the medical system, but as like you all have expressed, we have seen brokenness in the medical system, and so we try to incorporate in our practice when we're doing our physical therapy. Obviously, exercise is beneficial, but we also really emphasize, nutrition and all the things that that help with total wellness. And so we love to have resources because we're very busy in our practice focusing on the exercises needed to help them in that area. So we love to have resources of people that can, because to heal a person obviously takes many, many people, and it's a total body approach. And so, so we enjoy that. We try even, when in my practice, we have a lot of people that have a lot of emotional, psychological issues going on as well, and so we offer a support group once a month for people that have vestibular disorders, which has been really, really nice. We've gone about 4 months now, and these people are really excited to have an outlet and know that they're not alone. And so we have people with vestibular disorders, people that have had concussion, and in that world, like you were talking about anxiety and depression, I think on every history intake I see these days, anxiety and depression are marked. I mean, I'm seeing it all the time, and 20 years ago when I started, I don't feel like I was seeing those marked. And so we know that it's a total body approach. We know that there's such a component wrapped in that, and so any type of psychological, emotional help, we can give them support, and then obviously the nutrition will give them the energy to support their emotional being. So we appreciate all the resources that we're seeing here.
I think she covered it. I'm Megan McKinney, and we get to work together. We've been best friends for 21 years. We met at St. John 21 years ago, and just love to work together. And we are very different as therapists. It's funny. We complement each other. So it's fun because we kind of get from point A to point B differently and yet the same. So I would say, to reiterate what Holly is saying, we spend sometimes 2 hours a week with these patients. We'll see them twice. For an hour, so we get to know them. We build a relationship with them. They begin to trust us, and they really do start to talk to us about their problems, their concerns, their struggles, and we do have a lot of patients asking us, do you know this, do you know this, and they do seem to really trust our opinion. So it would be nice for us to have just a portfolio of clinicians that we feel comfortable with and feel very comfortable. So that would be really nice. Yeah.
My name is Dustin Ryloff. I'm a chiropractor. I work at Total Spine and Rehab right now. Eventually I will be going a good partner into her practice. Right now I focus more on musculoskeletal. We're more rehab based. I love adjusting. I think adjusting is great, but I kind of take a bunch of seminars. I love learning. I've gotten into a lot of muscle activation stuff now. So for me, I love, again, if I can activate some muscle on a patient and adjust something that can maintain for a longer period of time. I also do acupuncture. I specialize in seeing stuff that's not around. There's one called Dow, which I call musculoskeletal or myofascial type of acupuncture. A little bit different than dry needling. So I don't do any dry needling or anything like that. But for right now, I'm more focused on musculoskeletal. Eventually, we'll kind of turn more into the functional medicine and still keep a little bit of that practice.
I don't know which way to turn.
You can stand in
Right in the middle.
You can stand.
My name's Sarah Gomendi. I am a licensed naturopathic doctor, and I also practice acupuncture, and I definitely am familiar with some names in here. So I came to Tulsa to do my residency at Cancer Treatment Centers of America, so I got some good training in integrative oncology, and when we talk about just working together in a team approach, it's so important, not only from just naturopathic medicine, but just from the whole picture. And so I found that those oncology patients did so much better when they had that full team approach with all these practitioners. And I find that too just in private practice. So I was also at Tulsa Spine and Rehab for a little while, being able to work in conjunction with physical therapists, chiropractors, massage therapists, and then incorporating like the acupuncture and naturopathic medicine and nutrition pieces. Those patients did really well. So we did see a lot of musculoskeletal conditions, but I kind of work with conditions across the board. So I see mostly women. I think maybe just because women are more engaged in their health. But I do a lot with hypothyroid conditions, a lot with Hashimoto's. So that's one area that I find is not usually well managed when I see people. So a lot of times only TSH is being tested. We really need that full thyroid panel. We need to see what's going on, if there's antibodies, because for me, Hashimoto's is a completely different condition. It is. It's an autoimmune condition. It needs to be treated differently than just simple hypothyroidism. And I find a lot of people are taking all these supplements they found on the internet that says, oh, this is good for your thyroid. Well, it probably has nutrients in there that can actually make the Hashimoto's worse. So do a lot with that. Hormone balancing. I'd say, what do I say? I mean, the anxiety, depression, stress, definitely almost everyone has that. Sleep, because of that, it seems like hardly anyone's sleeping well. And then the digestion, one thing I always talk about is a lot of issues are starting in the gut and the inflammation in the gut from our diet and chemical exposure. So those are probably the top things I work with, along with the integrative oncology piece too. So, yeah, I'm happy to be here and to meet all of you guys.
Hi guys, Neil Thomas. I'm a chiropractor in Owasso, have Peak Wellness Chiropractic and Nutrition along with my wife, Dr. Amy Thomas. We've been in practice almost 15 years now, and chiropractically we see from birth till the end. Not after the end. So, but we see babies coming in for colic, for not sleeping well, ear infections. We see the young athletes. We see after any kind of car accidents. It's not a big part of our practice, but hey, when our patients are in them, they want a good place to go. We truly believe in the power of the adjustment. We know how it can turn on that nervous system and let it work the way it was designed to. And so it's a huge part of our practice. But with our patients, we want to meet our patients where they're at. We want to know what their goals are for their health, and we want to be able to work with them to meet those goals. If someone comes into our office and wants to get out of pain, we want to get them out of pain, and the next time they're in pain, they're welcome back in our office. If someone wants to come into our office and wants to get out of pain and then wants to get that problem actually fixed, then we will do that, and when that's done, next time they have a problem, they'll come back in. Or we have people that want to come in for a wellness lifestyle, and we gladly see all of that. Then I'm going to let Dr. Amy talk about the nutrition aspect of the office, because it's kind of what inspired us to get into nutrition and has led us on a great journey there.
I'm up. I'm Amy Thomas, and Dr. Neal and I met in chiropractic school, where a lot of chiropractors meet their spouses because they don't really let you interact with other people. There's no extra time. No, in fact, our class was pretty...
Very incestuous.
Our class was one of the, I think we had 12 or 15 couples that got married in our class. It's pretty interesting because you're in this, in our program, we went to Logan in St. Louis, and a lot of, our you don't leave your seat. Your instructors come through, at least in the program we were in, so you're sitting in the same seat for a lot of years. And so we saw a lot of things go well and a lot of things not go well. So you see breakups and makeups all, so just decide, we tell people it was deciding to date was almost a bigger decision than deciding to get married. So, because everybody knows, and there's no hiding it. But when we set out, like I'm sure most of you, we had a really a passion and a fire to make a difference in people's lives and to help patients, and then we opened, and like it was like we were speaking a different language to people. We needed to learn how to meet our patients where they were at, because not all of them wanted to what we wanted for them. We had to learn to help them baby step in that direction, because we were maybe a little much from the get-go, but we were super passionate, and that kept us going for a lot of years. We practiced in Montana for 9 years. Both our kiddos were born there, and we just felt to come closer to family. So we ended up in Owasso, and it was almost 6 years ago, and it's been a great move for our family. And the Owasso community has been very gracious, and it's a great place for us. The nutrition side of things, a lot of people end up in their profession for their own because they were seeking out answers for themselves, and that was me. I had 2 disc herniations from auto accidents when I was young, and so at 21 years old with 2 herniations and in chiropractic school, that was kind of I took a radiology final flat on my back because I couldn't miss the test, and I couldn't sit in the chair, so that's how I took it. And so chiropractic for me, I mean, I'm lucky because my chiropractor comes with me most places. I've been adjusted on the tailgate of a truck, in various trailhead park benches. I've been at Silver Dollar City. I've been adjusted lots of places because of these herniations that I have to I learned how to deal with. And but I was frustrated because I lived in a cycle of flare-ups. Every 3 to 4 months, I was in this, and it's great when your chiropractor walks into the office to adjust you and she's walking like this. It's not great for business, but it was very painful and frustrating for me. Like, I have a great chiropractor, and I was frustrated that I was always in this state. And so that really, the nutrition piece for me was really, we started seeking it out because of my own issues. And inflammation was the cycle that I was living in, and that meant I had to surrender some of my favorite things. But so when I work with patients, I help them understand the nutrition piece because of the way it fires inflammation. And we start with the gut, because I tell people the good news is you have 100% control what goes in your mouth. The bad news is you have 100% control of what goes in your mouth. And that's hard because there's a lot of things around food. There's emotion, and there's celebration, and there's, all the things we do in life seem to be centered around food. And when there's food categories that maybe aren't bad foods, or just bad for them, we have to surrender some other pieces that maybe we're not super excited about. So some people are able to, okay, can't have these, great. Some people, it takes a while, and I was one of those people. It took a while to surrender different pieces, and but what a difference it's made in my life. And you can live in this world and be dairy free. It's okay, but just helping my patients work